Hi, I'm Dr. Mariam Anna Umen, Consultant Oral and Maxillofacial Surgeon at AR Super Specialty Hospital, Kodungalur. Today I'm here to give you insight into maxillofacial trauma. Maxillofacial trauma is any physical trauma that happens to your face as a result of road traffic accidents, sport injuries, physical assaults or slip and fall. Most of the maxillofacial injuries are often associated with intracranial injuries. So once the patient reports to us in the emergency room, we often take a CT of the brain to rule out the possibility of any intracranial bleed. Then we move ahead with addressing the maxillofacial fractures. The maxillofacial injury can be broadly classified into soft tissue injuries of the face as well as injuries to the skeleton. When we talk about soft tissue injuries of the face, we mean by a cut on the skin of the face or any laceration on the face or within the oral cavity. The mode of treatment would be debridement followed by suturing by closely approximating the skin and the muscle layers. A scar is an inevitable process that happens in the case of any laceration on the skin, but however, with the expertise and the competence of a maxillofacial surgeon, it can be significantly minimized. Next is the skeletal injuries which happen as a result of high velocity injuries, that is the facial bone fractures, which is your fracture of the lower jaw, the upper jaw, the cheekbone, the bones surrounding the eye socket and the bones of the forehead. Facial bone fractures can often result in facial disfigurement and difficulty in functions such as difficulty in speech, opening the mouth, chewing the food. At times, in case of nasal fractures, it can cause an evident deviation of your nasal septum, also obstruction while breathing, and also difficulty in viewing properly. These facial fractures can be treated by repositioning the fractured jaw bones in correct position using mini plates and screws. With the advance in technology and the expertise of the surgeon, most of the patient who has sustained a maxillofacial injury can resume back to their normal activities and function at the earliest as possible. Thank you.